Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast.
So this episode, I would like to talk about COVID as well as the use of ivermectin and vaccines. So we've been getting a lot of questions, and I think this is a good episode wherein we can discuss on issues with regards to vaccination and the use of vaccines and ivermectin. So first off would be a lot of questions keep on asking would be is if you're going to do vaccination, can you still take ivermectin? Okay, so the answer to that, the short answer would be yes, you still can. The long answer would be we don't really know how long you should be on or off ivermectin before you do vaccination. But we do know that vaccination would mount an immune response from the body. Remember, with these COVID vaccinations, we don't really have yet the protection that it would offer, especially if you just had your first shot. So I would still recommend you to take your ivermectin if you already had your first or second vaccine dose. Okay, I think this was also discussed by Dr. Baron of Houston, Texas, when he was invited to talk to our Filipino doctors and public with regards to him doing the same thing, which was he was still taking ivermectin even after his vaccination because he knew that it doesn't really protect you from being infected, but rather protect you from having a severe form of COVID infection. So the question then next would be, when are you going to take your ivermectin? Should it be 1 week, 2 weeks after your dose, or should you stop maybe your ivermectin 1 week before your dose? So I think these are very, very common questions. So to answer that quickly would be the best answer is no one really knows. The safe answer would be if you really want to take your ivermectin, you can take it even at least 1 to 2 days before your dose. And then if you're going to take your ivermectin after your vaccine dose, I would suggest at least a week after, not before. The reason for that would be number one, ivermectin, all you have to remember, is also an immune modulator. So it might have an effect on your vaccine. So I would suggest at least a week after. We do notice a lot of people getting sick not because of COVID, but sometimes they do get some form of adverse reactions to the vaccine, whether it's feeling tired or or some fatigue or some form of fever, which is very common if you had your vaccine, especially on your second dose. So for these things, we do try to avoid giving ivermectin unless you are really tested and showed to have COVID infection. So remember, nobody really knows. So everybody's opinion is like fair game. So your my opinion would not have any study or backup, just like any other doctor who would say 1 week, 1 month, 2 weeks. So it really depends on the situation or the um, confidence of the person, right? So a lot of people who are going to take ivermectin may opt. I would suggest really at least 1 week away from the dose so that we avoid any issues that might happen when you are taking the vaccine and ivermectin. Okay, because as I said, ivermectin is immunomodulatory, meaning it might have an effect on your vaccine dose. So I hope that answers the question regards to vaccines and the taking of ivermectin. I'll be talking about the dosing of ivermectin. So lately, due to the existence of what we call a more infectious variant, or a more uh, supposedly a more severe form of variant, because some doctors and some researchers have noticed that especially the Indian variant, as well as our own Philippine variant, seems to be, they would say or claim that seems to be more severe. So, but we really need more data on that. But the dosing for this, as suggested by the new guidelines set by Dr. Pierre Corey and Paul Marek of FLCCC, is instead of the zero point 0.2 milligrams per kilogram dose, they would suggest, especially in areas where there's high number of people infected with these what we call Indian variants, as well as Philippine variants, or the UK variant. So they would suggest now zero point 0.4 milligrams per kilogram. So if you remember, zero point 0.2 is the original dose. Zero point 0.4 is actually double the dose. But I don't recommend you taking the double dose immediately. What I would suggest is you still continue taking your zero point 0.2 milligrams per kilogram dose as prophylaxis, as well as treatment. However, for treatment, you may opt for a higher loading dose, which is zero point 0.4 milligrams per kilogram. So let's say you're 60 kilos and you are supposed to take uh, uh, 12 milligrams, because zero point 0.2 and 60 is 12 milligrams. If you, let's say you do get sick, you may opt to do a zero point 0.4 milligrams, which is actually 24 milligrams. So 24 milligrams of ivermectin on your initial dose, which is your loading dose, and then the following day you just follow up with a zero point 0.2 milligrams, which is your 12 milligrams for a 60 kilos. So again, you have to compute this based on your body weight, not based on age. Okay? So please do remember that this is not based on age, but based on your body weight. Okay? Next dosing would be for children. Again, uh, in general, we don't recommend kids less than 18 taking ivermectin, because usually children have a very mild disease. They don't really require ivermectin. I think that's one thing that a lot of parents are worried about. But kids are the least that you have to worry about. It's really those adults, those who have comorbidities, that you really have to follow up and monitor very well. Now, the questions about, I keep on getting the same questions with regards to, women having, in being pregnant, as well as those who are breastfeeding. Okay, in general, we don't recommend pregnant women from taking ivermectin, only if it's really a moderate to severe form of infection. Luckily, we've been seeing, usually pregnant women have very mild disease anyway, so that's a very good, very good thing that would happen for pregnant women. However, for lactating, or what we call breastfeeding women, again, we don't recommend, because the ivermectin may pass on to the breast milk to your baby if you are in prophylaxis. Okay, in prophylaxis, I won't really recommend you or women breastfeeding from taking ivermectin. However, if you are breastfeeding and you've been diagnosed or tested positive for COVID, and you were really having a hard time, you are having a bit number of symptoms, then you may take your ivermectin daily. It may get passed on to your baby for sure, but remember, if you, as a breastfeeding mother, have COVID, most likely your baby also will have COVID. So if you really feel sick, then you are, I would say it's okay to take ivermectin if you really feel sick. with regards when you are infected with the COVID virus. Again, remember that when you are taking ivermectin, it is passed to the breast milk, and it might your breast milk might actually taste different, and your baby might say, "Oh, different breast milk." So you have to be aware of this. So again, for breastfeeding and pregnant women, I won't really suggest any form of prophylaxis, just for the sake of being safe for your babies. Thank you and good day.
Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.